Well, when I first started practicing functional medicine right out of residency, right out of standard allopathic residency. So I was approaching it more as an allopath would, thinking of it like a war or a battle. Like if we've got a bacterial infection, we need to kill it. If we've got candida overgrowth, we need to kill it. If you got a parasite, you need to kill it. And that's really all I thought about. I didn't think about much else more than that. And yeah, so that was my main start because that's how we're trained in infectious disease and in med school and residency to think. Yes, absolutely. That's all I was focused on because again, that's the mainstream infectious disease model is just to focus on killing the bad guys without any concern. I mean, the far extreme in Western medicine, of course, is to not even think about collateral damage. For example, if you have a patient with, two infections, you're not always thinking, okay, what happens if I kill one and we don't kill the other one yet? What happens to the second one? And that's been as I've my functional medicine experience has grown. It's led me to think more about, okay, if I give an antibiotic to a patient and they have a candida overgrowth, also what happens to the candida and what's the best order to treat those in, and how should I best focus on those? So that's that was my early focus. Yes, just killing the bad guys. And I thought, at that time that okay, I was being super progressive because I would try to kill the candida first, then the bacteria, but I was still mostly targeting on just killing the organisms. Again, because that's based on our Western medical training. If you've got the whole pathological basis of disease, which we're trained in med school, is that you have an organism that's causing an infection, it's causing damage, and you kill it, and the patient gets better. It's that simple, right? We think of that with anything, in any common issue. You get a staph infection on your skin, you just kill it. No wonder of why or how or what else that might do. You just kill it, and the patient gets better. That's how we're trained in med school, and that's how we're trained to think. Well, just had treatment failures, right? I mean, it works, some percentage of the time, some good percentage of the time. Just killing organisms did work for a whole host of reasons. Though over time, typically a lot of people had recurrences, or they had recurrent infections, or they had recurrence of symptoms, or they developed a new symptom or a new illness or a new infection that we then had to treat. So all of this combined together, treatment failures, patients not getting better, made me question what was going on. Um, or patients that got better but then developed another infection, subsequent to the first treatment. Or three, maybe they got a candida overgrowth after I gave them antibiotics, for example. Or four, maybe they just got worse after the treatment, not better at all, and that happened a percentage of the time as well. And keep in mind, I was treating complex cases. I treat a lot of complex cases, people that have already tried a lot of different treatments and have worked with different practitioners and had failures before they made it to my door. So typically, I was always getting the more complex cases. Again, as I just went over, the main thing is treatment failures and patients developing new illnesses or new symptoms after we treated them, or even a new illness after we treated them. Absolutely. So, as we'll talk about later, the big key thing that I now think of is microbial diversity, strength of the biome, having a good number of, for example, butyrate producers, having a good number of the right organisms and a lower number of organisms that are pathological only at higher amounts. Um, I I realized that when I was treating certain patients that we were just annihilating their good bacteria. So, for example, we might kill their infection, but they got another symptom somewhere else. For example, we killed an infection, but all of a sudden they got brain fog, right? Or we killed their infection, all of a sudden they got a vaginal yeast infection. Or we killed their infection, and then they got small intestinal bowel overgrowth a few months later. Or they got small intestinal fungal overgrowth a few months later. All of those things are happening in my patient population. Well, I think of the biome like a garden. And when we're killing, basically what we're doing is like we're spraying herbicide on a weed killer on the lawn, right? And that creates a bald spot in the lawn. So if we create a big bald spot in the lawn and we don't fill it with anything good and we don't encourage the regrowth of the lawn, so to speak, then what is likely to regrow? What is likely to regrow in that bald spot is whatever is already present in that person. So if they don't have a lot of diversity, which by definition they usually don't when they're having infections, then usually you get a lot of pathobionts, pathological organisms, or even overgrowth of commensal organisms filling in that bald spot on the lawn, so to speak. And if you've done any gardening, if you have a bald spot and you don't replant good grass and you don't fertilize the grass and you don't do anything to maintain the grass, then the weeds are just going to recur over and over again. And that's what I've seen in some patients. And I've been treating patients in functional medicine for 20 years, and I've had some patients who've had the same recurrent infections for 5 years or so. It's taken a long time to figure that out. The other reason that happens is because of something called biofilms. So a lot of organisms are surrounded by what's called biofilms, or like a mucus layer that surrounds the organism and protects the organism from being killed by the immune system, and also protects the organism from being killed by any antimicrobial herbs or antibiotic medications that you might use, or antiparasitic medications that you might use. So these biofilms are like a defense mechanism that the organism uses to protect itself. And if you do not treat the biofilms, that is another reason why the patient gets worse and why they might have recurrence and might not get a complete resolution of their infection or symptoms. It's played a huge role. I went to Nepal after medical school when I was 25, and I spent quite a long time there. And it's pretty much a rule of thumb: if you're in Nepal more than a couple of weeks, you're going to pick up a GI infection. And I was there for 4 months. So unfortunately, I picked up a whole host of infections, many of which has taken me decades to actually understand and appreciate and diagnose all of them. And so I was first diagnosed with something, I think, in the amoeba family. So I took antibiotics for that and got better. And then, a few months to a year later, I got new symptoms and something else. Already by residency, I was already having irritable bowel syndrome, and then I was diagnosed with celiac disease and a dairy intolerance at that time. And so basically, it took me 10 to 15 years to figure out that this whole microbiome lawn analogy, and to appreciate that if we're not really focused on recreating the biome, if we're not focused on healing the biome, and if we're only focused on killing organisms, then we kill one organism. It's like playing whack-a-mole. We kill one organism, and then another bad organism just takes over the space, that bald spot in the lawn that was created by killing the first one. And then we've got another problem. So then we take another round of antibiotics or antimicrobials or anti-candida or antifungals. And then the same thing happens again. We get another bald spot. Um, and so I have had, numerous protozoal infections, parasitic infections, candida infections, and fungal infections. So I've had to deal with all of this over time. So, for example, when I took the if I take, when I've taken antibiotics for infections, then I got an overgrowth of yeast and fungus. When I took antibiotics for H. pylori, then I got overgrowth of other gram negative organisms that were not killed by those antibiotics that then created a higher load of those pathogenic organisms. So then you get not only those organisms at a higher number, but you get the toxins they're releasing also at higher numbers. Well, the easier cases was a patient coming in with, something like an H. pylori infection or an amoebic infection or a blastocystis hominis infection. And we treated them with antiparasitics because that's what they were referred to. They were referred to me to get a prescription for antiparasitics. I gave it to them and they got better. The difficult cases were the ones who maybe they had, in addition to that parasite, a candida overgrowth or a fungal overgrowth, or we treated them and they got worse, or we treated them and they got better for a few months and then they got worse again. So this is all, again, part of the big picture that I've learned over 2 decades of doing this work, that um, that there's much more to appreciate. That if we're not focused on healing the biome, then we're missing the big picture. And when we look at longevity research now, my main specialty is longevity. When we look at longevity research now, we know that biome diversity diminishes over time and is associated with all the symptoms and all the markers of aging, meaning as our biome decreases in number of bacteria, so does our physical vitality and markers of vitality. Um, those all go down, where our markers of aging and symptoms of aging all go up. So this is something I was exposed to earlier in my functional medicine career, but did not appreciate fully. So treating the terrain means, rather than focusing on quote the bad guys, the parasites, the bacteria, the bad bacteria, the candida, the fungus, etc., to first start, or in parallel, to start treating the biome, to to feeding. So think of, we'll have other videos where we talk about the terrain as a lawn. Again, think of this as a garden or a lawn we're trying to cultivate here. And treating the terrain means, one, adding more biodiversity into our diet, especially in the plant and fiber diversity. So now research shows that we want to have 35 to 40 different plants in our diet on a weekly basis. And when we do that, we are introducing the fibers into the diet that feed the good bacteria. Those good bacteria then digest the fibers to create, they use the fibers to create nutrients that then we use. So it's the terrain is actually a symbiotic relationship with us. So all the organisms in the intestinal tract are producing chemicals like short chain fatty acids, for example, that are impacting our nervous system. They're impacting our brain. They're impacting our mood. And they can do that in a positive manner or a negative manner. If we have a good terrain, they will produce positive, beneficial chemicals and nutrients. And if it's a negative terrain filled with pathogens, they will create inflammatory chemicals that impact our nervous system, chemicals like ammonia that impact our brain, cause brain fog and anxiety. The organisms in our intestinal tract can produce chemicals like histamine that cause allergies and anxiety and insomnia. They can also produce things like lipopolysaccharides that are highly inflammatory chemicals, basically that impact our liver health and our brain health. And so treating this terrain is critical. We want to, by treating the terrain, we want to one, increase the diversity of those of the good bacteria in our patient's intestinal tract. Two, we want to feed all of those diverse bacteria that we are nurturing, and in so doing, they will then produce these chemicals and nutrients that are symbiotic for us as an as an organism as well. Again, the main thing I recommend for strengthening the microbiome environment are plant diversity, having 35 to 40 plants in our diet per week, having large amounts of fiber in the 40 to 50 grams per day in the fiber category. And that has to be done slowly. You can't, if you introduce this change into patients too quickly, you'll get a lot of side effects. This has to be slow introduction of change into our patient's microbiome. There are also things like polyphenols. So polyphenols are chemicals present in a lot of berries and a lot of herbs that are chemically altered by our biome that then also produce nutrients and chemicals that are useful for our own brain, our own nervous system, and our own gut healing. I would encourage them to look at all the latest research on the biome and the importance of the biome. I would encourage them to use as narrow spectrum antimicrobials as possible. That means using prescriptions and or herbs that only kill the bad guys in question and that have as minimal negative impact on the positive microbiome bacteria as possible. For example, there are herbs that I used to use, like grapefruit seed extract, which are pretty broad spectrum and kills a large amount of our short chain fatty acid producing biome. So I use fewer and fewer of these now, and I would encourage new practitioners to think like this as well. And I would highly encourage them to think on, rather than start with killing, to educate their patients that the main thing we want to do is to support the biome, because as we support the biome more and more, that healthy lawn has a natural crowding out effect on the bad guys and the bad bugs. Just like if you have a healthy lawn outside, you don't have a lot of weeds to kill, because the lawn takes care of the weeds. There's nowhere for the weeds to implant. And the lawn actually is already established there. And as it's already established there, it prevents the bad bugs from implanting. It prevents the bad bugs from multiplying. Even if a couple of weeds get in, not many are going to. And that's why we'll see some patients who might have like low levels of quote bad bugs but don't have any symptoms. It's because they have so much microbiome diversity in such a good healthy lawn that nothing can implant there really. Yeah, so we've taken the latest research into the microbiome, and there's so much out there that I did not even realize until I started my work on Physician Logic Squared. There's so much research, and there's more coming out every day on the benefits and the impact of the biome on our overall health. So again, my main specialty is longevity. I do a lot of work with dementia prevention and early cognitive decline reversal. And so what I see is my patients who have the highest diversity of microorganisms do the best over the longest period of time. So when we're building Physician Logic Squared, we're really in our engineering and in the way we are creating the model, we are putting an emphasis on microbiome health, microbiome diversity, plant fiber intake, fiber supplementation, et cetera, so that we can build this healthy lawn that then will allow the patient to reap all the benefits of having a healthy biome versus just targeting, let's kill that bad guy, let's kill this bad guy, and hope for the best. Well, I wish we had all this amazing research on the biome and how it impacts the brain and how it impacts systemic inflammation earlier in my career. It was not there at that point. So I work in longevity. I will do a lot of work with hormones. We now know things like, I so wish I knew that inflammatory chemicals in the intestinal tract, that lipopolysaccharide I mentioned earlier, for example, it blocks in males testosterone production. It can block thyroid production and thyroid conversion to the active hormone. And not only that, but it can cause systemic inflammation. It can cause liver stagnation and liver symptoms as the liver tries to filter it out. So I wish I knew all these connections between how the biome and these pathological organisms and inflammatory chemicals were causing systemic effects. Because in the past, I would start by treating patients more by killing the bugs, and then I would target treatments for, let's work on the hormones, let's do this, let's do that. And now the main thing I start with is, hey, let's get the biome in the best possible place, and then a lot of other symptoms resolve and a lot of other hormones come into balance. This shift has influenced our build from the ground up. So we are building a gut-brain axis at Physician Logic Squared. And what does that mean? We are looking at the real connections between the microbiome diversity, pathological organisms in the intestinal tract, inflammation in the intestinal tract, chemicals produced in the intestinal tract, and how those are impacting cognitive function. So, for example, when we have patients coming in with brain fog and early cognitive decline, rather than treating these with typical functional medicine algorithms, meaning you just throw a lot of supplements at the patient hoping that they get better. Instead, we test for those. We're recommending using the latest state-of-the-art GI testing, including PCR testing, but also including 16S and shotgun metagenomics testing. And what that means is we are able to identify, using state-of-the-art technology, what is impacting the patient systemically. So we are connecting the dots between what's happening in that patient's brain, what's happening in their nervous system, and their intestinal tract. And with our goal of looking for the root cause of why that patient is having those symptoms, and how can we treat that root cause to produce the biggest impact on that patient to lower their cognitive decline, slow their cognitive decline, and even reverse their cognitive decline. So, for example, when we have patients coming in with cognitive changes consistent with early onset cognitive decline, early onset dementia, the first thing we are doing microbiome tests to assess microbial diversity and to assess microbiome toxins. We're also looking again for inflammatory markers coming from the biome, such as lipopolysaccharides. We're looking for chemicals being produced in the biome like histamine and ammonia that have systemic effects on the brain, on the nervous system, on sleep, on cognition, on memory, etc. So this is the basis upon which we are building Physician Logic Squared, connecting those dots between the microbiome and the brain in a real, concrete, solid, scientific manner.